When I first stood before the ministry during my maiden speech on 1st of April 2025, the situation was critical. We were 6 months into the Taifa Care rollout, facing public scrutiny and systemic roadblock. I told the country then that, and I was given a name that I am a bulldozer, and that was for the right reason, to clear the way for universal health coverage, but to crush the bureaucracy and to build a system that works. Today, I return to report to the people's representative how that ground has been cleared, what we are building upon it. And I want to start with the first pillar, the pillar of sustainable health financing. I wish to begin with that pillar, and the transition from NHIF to Social Health Authority is the engine of our reform as an administration and a country. The numbers tell a story of unprecedented success and stability. As of 26 January 2026, we have registered 29 million Kenyans into the Social Health Authority. This mass registration has translated into tangible financial health for our system. We have collected 130.4 billion in contribution. And critically, we have disbursed over 93.4 billion to healthcare providers, both in public, in private, in faith-based, and in our national referral hospitals. Contrary to the inefficiency of the past, we are making great strides in settling all verified, validated claims. Currently, we have achieved an average claim settlement rate of 73% across the board. This means that money is flowing to our hospitals, ensuring that facilities remain stocked and operational. Honorable Speaker, as I say that, I want members to be cognizant of the Schedule 4 of the Constitution, that health is a shared responsibility, that health is a devolved function. A key component of this financing model was the realization through this House of the free primary health care, which has never happened in our country before. We are currently rolling out service charter to primary health care facilities across all the 47 counties. And we are doing this from last week because Kenyans go to primary health care facilities, level 2 and level 3, as the dispensary and the health center, but they are forced to co-pay. It's supposed to be walk in and walk out. So we have created now a charter, a green label charter, which we are going to fix, and we have started with the Bomet last week. We'll fix it in every level 2 and level 3 public, private, and faith-based health facilities. This charter, and I want to highlight that Bomet Health Center, which has the distinction of being the first facility to successfully roll out this charter. This charter is our promise to the people that at level 2 and 3 facilities, a Kenyan citizen should be able to walk in and walk out as an outpatient without paying a single shilling. We have already seen 800 million Kenyans have accessed services at the Primary Health Care Fund, proving that when financial barriers are removed, our people will seek care early, preventing complications and saving lives. To ensure that this safety net covers everyone, including Mama Mboga and Boda Boda riders, Honorable Speaker, in June of 2025, during Madaraka Day in Homa Bay, President Ruto launched the Lipa Sha Pole Pole initiative. We understood that the informality of our economy requires flexibility. This innovative payment model allows Kenyans in the informal sector to make a small, manageable contribution towards their health cover rather than a lump sum. This has democratized access to insurance, ensuring that economic status is no longer a barrier to quality health care. We are currently having over 410,011 active payers utilizing this SHA Lipa Pole Pole. And so far they have contributed over 1.4 billion, a clear indication that Kenyans are willing to pay for their health when given a dignified option. We are also committed, Honorable Speaker and members, to ensuring that the most vulnerable among us are not left behind. The national government is currently sponsoring over 558,000 indigent households, picked from the social health protection data in all our villages and all our counties and constituencies. And those 558,000 indigent households are having the social health insurance fund premium cover. I must also commend a number of counties, and one of the most best counties, Muranga County, which has set a gold standard by fully meeting its statutory obligation and sponsoring over 38,000 indigent households and remitting their full annual premium of the chief. And we asked more other counties, Makwiny County, Kisumu County, most of our other counties are also preparing their list between 10,000 to 20,000 indigents so that they can pay for. Honorable Speaker, furthermore, through the through the national government CDF, a number of members of parliament have paid for indigents from their constituencies. And you can see the list here. And there are more that we are going to post. And I have asked the CEO, Honorable Deputy Speaker, representing a number of our women rep, has also submitted the list. And I've asked the CEO of SHA to make a dedicated desk and staff to attend to members of parliament, starting tomorrow, once this workshop is finished, so that the figure is known, the figure has been agreed, and is a flat figure, and we want in your constituencies to give us the list. If you tell us to pick it from the database, we will pick it from the database, social protection, but we want our members of parliament, and they have been doing it even before. But right now, because members are asking me, how do we do it? I have directed SHA, now that they have a skeleton staff, to dedicate a specific desk that, and even come to parliament. The clerk of the National Assembly, through the speaker, can even give us a room within parliament where the SHA members can be accessed by members of parliament. Members of parliament do not, even your offices, your staff can access our team in parliament, but we really want. We have collectively together, we are sponsoring partners and development and philanthropies are sponsoring close to 62,000, if I add with the ones of members of parliament. But I want to urge the honorable members to utilize the national government CDF to sponsor the indigent in your constituencies so that we mirror this success to ensure the universal coverage. Honorable members, for a long time, the overseas